Talk a little about diabetes, which a lot of people call high sugar, and just the treatment of it and how important it is for the elderly. A lot of things have sugar. A lot of us like to eat sugar. There's Halloween coming around, so we got stuff we give out even at the office when they come by. And just how bad is eating sugar and how important is it to treat sugar. We are so obsessed with diabetes in our society that we've invented a term called prediabetes. That means before you hit diabetes, you're still sick because you have prediabetes beforehand. And the funny thing is that prediabetes doesn't actually confer any danger to anybody, nor is treating it an option, but we just like to label people with things. So you could have that label. In fact, I always tell my patients we all have prediabetes because any of us could get diabetes at any point. So welcome to the world of prediabetes. Diabetes itself is very difficult in terms of knowing how aggressively to treat it. But if you go to a diabetes doctor, an endocrinologist, very likely you'll be treating it aggressively. You'll want to get your sugars down, you'll check your sugars on a regular basis, you'll take medicines to make sure the sugars get below a certain level. And there's another test we measure called the A1C, which we're going to try to get below a certain level as well. But how effective is that, especially in the elderly? There are two really big studies that show that treatment of diabetes in the elderly with aggressive medicine actually leads to more deaths, more heart attacks, and more strokes than less aggressive treatment. In addition, there was a study done recently looking at nursing home eligible people. These are people who may be a little demented or maybe a little physically impaired, who need extra help, and it looked at various levels of diabetic control. And the people with the worst diabetic control, the people with hemoglobin A1Cs above 9, actually lived the longest and had the best function. Now, if you went to a diabetes doctor with a hemoglobin A1C of 9, they would faint on the floor. They'd be down because that is a terrible diabetic control. They like to get people below 7, sometimes in the low 6s. And that means aggressively treating diabetes. But what we know is the more you treat diabetes, the lower you get the sugar, the weaker people are, the more they fall down, the more confused they are, and the less functional they are. And we also know they die earlier. So why are people doing that? The reason is because people are obsessed with numbers. They figure the lower the sugar is, the better and healthier they are, which is absolutely false in diabetes. In fact, people who check their sugars regularly are more likely to have side effects from low sugars. To complicate the matter, the treatment of diabetes with medicine actually is dangerous in and of itself. Not only is lowering the sugar too much dangerous, but many of these medicines cause problems. The most well-known medicines, which are glipizide, gliburides, what are called sulfonylureas, increase your risk of heart attack. People who don't take the medicines have a lower risk of heart attack than the people who do take the medicines. So by treating your sugars, you're actually increasing your risk of heart attack. A medicine like metformin, which is a relatively good medicine, can cause many other problems, including some that are lethal. And many of the other medicines cause increased heart attack and stroke risk. Insulin itself is dangerous. It causes weight gain and it causes problems with dramatic drops in sugar. In fact, real low blood sugars can cause immediate harm, whereas high sugars don't. So the bottom line with diabetes is we like chasing that number, but the more aggressively we treat it, the worse people do. It's a number we should really let alone. The Medicare guidelines suggest fairly modest treatment of diabetes and do not push for very aggressive treatment in the very old, but they do nothing to suggest that over-treatment is a problem. So diabetes is yet another example of why we should be more relaxed and not worry so much about all these numbers. And once in a while, you know, a little of this is okay.